Hi, everyone. Thank you so much for joining. Thank you for joining our webinar on staying audit ready in the lab. My name is Lance, and I'm a product specialist here at LabKey. I help different organizations evaluate their lab-specific needs and how it may fit with our software sample manager. I also help to implement and onboard any new clients and act as a point of contact for any customer support needs. Before my time at LabKey, I actually worked in a heavily accredited infectious disease laboratory where I participated in my own audits. So I'm really excited to kind of share my experience and discuss with you all today on how to remain audit ready and how LabKey as an organization can help stay within compliance. So as we wait for folks to kind of filter on through, we'll have a poll posted. Let me go ahead and get that up really fast. So how ready is your lab for a surprise audit? Let us know by picking whichever emoji best fits your face if you think about an auditor walking into your lab right now. And as you select which one fits, we'll go into an overview of what we'll cover today. So we'll kind of start with who LabKey is as an organization, and then we'll dive into what does it mean to be audit ready, the different types of audits you may encounter, the different stages of being audit ready, how to prepare for the actual audit itself, and then how can software help you. So to start, as you continue to kind of answer the poll, a little bit more about LabKey. We're a science company. We're scientists building software for scientists. So a lot of us used to work in the lab and participate in our own audits. And LabKey itself actually started with the Fred Hutch Cancer Research Center here in Seattle, Washington. So we have over 20 years of experience helping organizations from academia to pharma and biotech to government research to mining, bunch of different types of sciences. Our software comes with that unparalleled support, and we work very closely with all of our clients to make sure that we're continuing to build our software to make it easier for an audit, to make sure that we're helping with those workflow processes and data management. So it looks like we have some responses in our poll. It looks like we're a little unprepared is kind of the consensus. So a little bit nervous, but it's not too bad. Hopefully a surprise audit wouldn't be that much of a problem, but hopefully we'll go from being a little bit more impaired to at least being okay or being ready altogether. So thank you so much for answering that poll. So really, let's go ahead and dive into things then. What does it mean to be audit ready? Why are we here today? Being audit ready means that your lab is maintaining organization, compliance, and documentation that are up to the regulations your lab requires. These regulations can be set by laws, accreditation bodies, or by your specific lab setting its own standards, or it could be a combination of all of those. What's really important to remember when it does come to being audit ready is that this compliance is centered around personnel behaviors and if they're adhering to the standards that are set. Supporting staff with tools like software can really make compliance and being audit ready all that much easier because it allows them to kind of focus on their specific tasks instead of trying to pull everything all together. So with that, there's a lot of benefits of being audit ready. It's something we really want to strive for all the time. Being audit ready can help minimize those findings and nonconformances. And this can help make sure that you remain accredited and reduce the amount of corrective actions you need to take. It can also help make sure that personnel are more confident with external audits and make audits themselves run a lot more smoothly. Being audit ready also helps to improve your long-term data integrity. So you know that the data that you're entering is going to be more accurate. You're not going to have as many typos, that it's easier to search for that data and really understand what's going on. It can also kind of lead into ensuring operational efficiency and effectiveness. You're not going to have to spend hours looking for your documentation or for a record that's somewhere in your system because it wasn't named correctly. Being audit ready helps you make sure that your SOPs are up to date and that you'll reduce the amount of chaos and overtime that can occur when an audit does happen. It's just to make sure that everything's in order. So we really want to try to reduce the amount of time we're spending here. And then at the end of the day, being audit ready can help make sure that you're building confidence with clients, regulators, and other stakeholders because you won't have all those nonconformances that are kind of going against you. You'll be able to provide answers to them in a very quick and efficient way. So there's a bunch of different types of audits that you may encounter. These audits can vary in the scope or what they're looking at in your lab. They can vary in exactly who is conducting that specific audit and then the timing of that audit. Regardless of what type of audit it is, it's still going to look at your lab's processes, your organization, documentation, and personnel behavior to identify areas for improvement. So you're going to kind of hear me repeating that a lot because really at the end of the day, that's what we'll be really wanting to focus on. So when it comes to different types of categories of audits, we're first going to look at who is going to be auditing you. So these mainly fall under two different categories. You have your internal audits and your external audits. Internal audits are going to be conducted by your own organization, but ideally they're going to be done by someone outside of your department. This is because that someone outside of your department might be able to catch some more errors that you're not, right? You might be kind of blind to the way things are, or maybe you don't realize something's written a specific way in an SOP because you don't look at it when you're carrying out your workflow tasks. External audits, on the other hand, are conducted by people outside of your organization, a third party. These can be regulatory or accreditation bodies, or they can be a client of yours. External audits can be mandated by that regulatory body or by law. So those are things that you have to do. And then some other third-party audits can be a bit more optional, things like client audits. You don't have to do them, but sometimes it is nice to do it. Some organizations will allow their clients to audit them for free, especially if it's in response to a quality concern, while others may actually charge their clients to come and audit them. That's because audits do take quite a bit of time and effort to go through things. And then I know if some organizations have a lot of clients that are continuously wanting to audit them, sometimes they'll opt to have a third independent party represent those group of clients and then come and audit that organization just once instead of having to do it over and over again. And this in turn can help save some time and money. So those are kind of the two main types of audits when we're looking at who's doing it. But audits can also vary in the timing of it or how much notice you have before an auditor actually shows up at your lab. So one of the easiest types of audits to prepare for are scheduled ones. These are ones that you know are coming in advance. This allows you more time to prepare your documentation, to make sure that your personnel are following your lab's policies, and just overall prepare everything. Then there are surprise audits. These audits are going to happen when you have little to no notice. These are conducted by regulators sometimes, or sometimes by your own internal organization. And really, these are great for finding issues in your lab or ways to improve your processes because you're not going to be on your best behavior. You don't have as much time to prepare. And this is just how you really operate on a day-to-day basis. So this is going to be good when you're wanting to try to find rooms or ways to improve your lab. Then there's reactionary audits. These are going to be in response to there being an issue somewhere in your lab. Something happens and now you need to investigate and find the root cause of what happened. So you'll go through your audit and then you'll hopefully find whatever caused that problem and then follow up with a corrective action to kind of prevent that problem from occurring again. Now that we know about the different types of audits there are, how do we really stay best prepared for them, right? We always want to stay audit ready in case we do have that surprise audit come through. We want to act like every day an auditor may walk in. So really the first step of being audit ready is going to make sure that you understand your regulatory requirements. You want to go through all of the guidelines that you have from your accreditors, from bylaws and whatnot. These are also going to be updated on a somewhat regular basis. There's always new laws being passed. Sometimes there's new guidelines. We discover new things that we need to do. So you'll want to make sure that your knowledge stays up to date and that you will always go through it all. In response to these updates, you'll also want to be updating your SOPs or your operation protocols. SOPs can be updated not just in response to new guidelines, but it can also be when you have a new workflow process. Maybe you're taking on new testing. It can be that you discover improvements that you can make in your own lab. So you want to incorporate those into your SOP, or it could be in response to an audit finding. Once your SOPs are updated, you'll also want to make sure that all relevant staff are trained to them. You'll also want to make sure that your staff are trained to existing SOPs that haven't had anything changed to them, but they still need to go through it on a regular basis. These trainings should always be documented, and you should always have them signed off by other lab staff. And in my experience, when I worked in the lab, we would have a set amount of SOPs to review every single month. That way, it wasn't all piled onto us at the end of the year or something where it would pretty much overwhelm us. For those few SOPs that we did review, we would take a short quiz to make sure that we understood the training. And then periodically, we'd have senior staff kind of supervise us and watch us carry out our lab tasks to make sure we were adhering to those SOPs and that we were doing everything correctly. If we did something wrong, we'd have follow-up training to make sure that we kind of changed our behaviors and followed what we needed to do. So keep up with that training and make sure it's all documented in a central location. It's going to be super important. Kind of going along with training is that we'll want to practice our audits. This is a really great step in making sure that you're ready for an auditor to come through. You'll want to use internal audits as a way to kind of practice for when that accreditation body is here. These internal audits can help you better prepare your documentation and records, see that, wow, these documents were kind of way over there. It took me a bit to pull them. Maybe we need to kind of move them around or relabel them. It can also just help you feel more comfortable walking through your lab with an auditor and making sure everyone kind of knows exactly what to expect when they're here. These internal audits and practicing can also identify areas where your lab can improve before an external auditor finds it. So we really want to try to make sure we're keeping up to date with that. And then at the end of the audit, whether it's external or internal, you'll either want to receive a report or create one yourselves with any nonconformances identified. Once you receive those nonconformances, you'll have a chance to review them and see if you agree with the findings. Sometimes auditors are from a third-party agency, so they don't necessarily understand the guidelines as well as some other folks do, so you can argue against them if it does seem like it's incorrect. But regardless, you'll still want to review them and then take corrective actions if needed and kind of go through this entire process again. You'll see it's a circle. This process is never going to end. You're going to want to keep up with it and really make sure that you're staying within your guidelines and being audit ready. So we'll have another poll kind of pop up. It's going to be asking you where you are in being audit ready. So what stage do you think you're currently at? Of course, you might be under multiple, but which one do you think kind of matches your stage best? Are you thinking you're still understanding your regulatory guidelines? Are you working on training and internal auditing? Kind of where are you? As y'all kind of fill out this poll, you still might be thinking, wow, this is still a lot. I don't really know exactly where to start when we are doing our internal audit. So we'll kind of go over what is understood as an audit checklist. An audit checklist helps guide you through the entire audit. These checklists focus on specific areas to make sure that your lab is prepared, and they can be pretty detailed. So you'll want to have these checklists as you are going through your lab. These can go in making sure that you understand your regulatory needs and your documentation, but they're going to be pretty important for you all. You can find kind of general checklists, but you'll always want to update them, make sure that it fits your specific labs, and goes as detailed as you need it. And then as you are going through the audit with them, kind of check it off with them and see if you've deviated anywhere in your audits. If you have deviated anywhere in your audit, you want to make sure you mark how severe that deviation is, right? Some of them you might just be missing like a check, or maybe you didn't use the right pen when doing something. So those are kind of more audit or minor audit findings, but then there can be more severe ones that can impact the health and safety of your staff or for patients. And then as you're going through that audit with your audit checklist, also make notes, general comments on where you think you can make some changes. So you can kind of go back through after the audit is all done and understand exactly what was going on. So it looks like most of us are currently at the internal auditing stage, but it also looks like we're updating our SOPs and understanding our regulatory requirements. So that's great. And again, you're going to be at these different stages all the time and kind of making sure everything is as it should be. So thanks for filling out that poll. So moving on to our audit checklist, we're going to kind of make sure we focus on documentation. This is probably going to be one of the first and maybe one of the most extensive areas of your audit checklist. So you'll want to make sure you have complete and accurate records, that it's easy to find these records, and you're using document or version control so you know what's changing from one draft to the other. And then you want to make sure your audit trails are thorough. So what does that really mean, really? Well, when we're looking at making sure that it's easy to access these records, we want to make sure that we're using similar naming conventions so we don't have to search through a bunch of keywords just to try to find the right document, and that they're kind of stored in a central location. In my experience, it was easiest to find these records is when we kind of scanned physical records into our system, and that we associated them with either specific instruments. If we're doing like calibration tests, we'll associate it with that instrument we calibrated, or if it's going to be like a requisition form, we have it with a specific patient or specific set of samples. That way we can just go to that patient, find all their records, super easy to do. When it comes to making sure that the audit trails are thorough, you want to know who did it, when they did it, why they did it, what they did, what changes were made. So those should also be as thorough as possible. Just as a little tip too, I know I said like scan your records into an electronic system. Some regulators also require you to physically store these documents. You can't just throw them away after you scan them. So make sure you are paying attention to what those guidelines are, just to make sure that we're doing what we're supposed to do. Some folks will store their physical records in their on-lab premises, or they'll store them in a third-party facility, but you'll still want to make sure they're pretty organized and easy to access in case the auditor does want those physical records. So after documentation, we'll also want to look at SOPs. Those are kind of hand in hand, but the SOPs should have their own specific section within your audit checklist. These SOPs should follow regulatory guidelines to help your staff carry out their specific tasks. And you'll want to regularly review these and update these, kind of as we mentioned before, to make sure that they are following those guidelines and that you are improving your workflow processes. But then you'll also want to make sure that your staff are regularly trained to them. Auditors will sometimes ask to have an SOP in hand as they go through your lab, and they'll watch your staff as they kind of read along the SOP, and they'll mark where your staff isn't correctly following that guideline. So when you're doing those internal audits, have that copy of your SOP in hand and mark where your staff are struggling. Maybe the SOP needs updated because it's difficult to understand or there's too much room for interpretation. So mark off where it needs to change and then either update that SOP or maybe you need to retrain that staff in following it. Then you'll want to maintain good lab practices. So to do this, you'll want to use method validation and quality control. One of the best ways to do that, in my opinion, is that if you're doing a bunch of tests on your samples, you'll want a third party to send in tests that have previously had their results confirmed. You'll test those samples like any other sample, and then if you get the same results as what was previously confirmed by that third party, you can feel a bit more confident that your instruments, your test kits, your processes are working as intended. But you'll also want to monitor your test results. Let's say you have around a 25% positivity rate for a specific virus with your samples. If suddenly you have a positivity rate of 50%, that might be a red flag that something else is going on. It could be that there is an outbreak in disease that's definitely happened and it's definitely possible. But it could also mean that maybe there's an issue with the test kit you have, or maybe your process has something wrong with it. So monitoring any unusual patterns in your results can help not only you feel more confident with anything, but should something happen, it can make your investigations that much easier when you can catch an unusual testing pattern much earlier than waiting for a client to complain about having all of their results suddenly being positive. You'll also want to make sure that your system is very traceable and you can track a chain of custody, especially with your samples. You'll want to know when samples are being moved around, when they're being tested, and who is doing all of this. This kind of goes back to that audit log. To make this process a lot easier, you'll want to kind of move towards automation, and it could be as something as simple as using barcodes to quickly scan in a bunch of samples and then check them in and out of a freezer or into a workbench. This helps you know exactly who did what and who had possession of it, while kind of getting rid of that manual process that could lead to typos or to just how long it takes to manually type in a sample ID. And then going back to it, it kind of goes back to personnel and training. It's always going to be about the behavior of the staff if they're doing things correctly. You can have the best SOPs in the world and you can have the best software in the world, but if a client or a lab tech isn't doing what they're supposed to do, that can mark you as non-conformant in your audit. So you'll want to make sure that your staff is well trained. Are they adhering to the SOPs and fully understanding them? Are they using the software as intended? So you'll want to make sure that the staff are competent in their roles and fulfilling those training requirements. And then you'll want to document all of that training and have it easily accessible. But then you may also need to document continued education for your lab staff. Some regulatory requirements mean that your staff needs to continuously learn. That could just be attending webinars like this one. It could be that they need to have additional training, reading peer-reviewed articles, going to different conferences. And then you'll also want to make sure that you have all of your staff's required certifications or educations, like if they need a bachelor's or a master's degree. All of these points should be documented and easily findable when an auditor does happen because they will ask for staff records. So make sure you can pull it in a central location and that it's organized by each staff member. Uh, and then finally, it's going to be super useful to make sure that your staff are actively involved in providing feedback on how training is going, how their day-to-day tasks are going, and if they see if there's any improvements that could be made. A lot of the time, executive staff aren't necessarily involved in the lab, so you'll want to speak to the actual lab techs. They may have issues that maybe you were blind to, that you didn't know what was happening. And then this collaboration can make them feel more heard, can make them feel more excited about their jobs, and making sure that they're heard, which means that they're going to do a better job. So to review, how do you stay audit ready? You're going to want to use that audit checklist that we covered. It's going to be customized to your own unique lab setting. And you'll walk through this audit checklist as you go through all of these different stages. You'll want to implement a system for continuous monitoring and improvement to make sure that you're staying up to date with ever-evolving regulatory requirements. Your audit checklist should have all of those requirements detailed. Then you'll want to update your workflow processes and SOPs in response to these reviews. Do those SOPs match those guidelines? And then does your audit checklist mean that you're going to read that SOP as your staff is carrying out those specific tasks? You'll want to engage your staff to actively participate and maintain a compliant and audit-ready environment. They should practice what it's like to be audited and make sure that their training is up to date. Any findings you have while practicing your audits or within an actual audit should then be reviewed and included in part of your review process of creating updated corrective actions, updating your SOPs, and going through that whole process again. To make this easier, you're going to want to use tools that support compliance and make auditing ready. Use that audit checklist to make sure you are organized and following those regulatory guidelines. You'll want to use software that tracks electronic records of everything going on in the lab and centralizes all of your documents together. And doing so, with doing all of this, you'll help to minimize those audit findings and non-conformances. You'll streamline your workflow processes, and then you'll build confidence with those clients, regulators, and other stakeholders. So how can software help, right? This is kind of leading up to centralizing your documents with the software's help, making sure you have that audit log. That audit log should track the history of every single action you're doing in the lab, from sample management to data processing to all of the documents you have related to your staff. It should have those version controls so you know what's changing from one version of a document to another. You know who did what, when they did it, why they did it, where they did it. Then you'll want to kind of standardize your data entry. You shouldn't have 5 ways to say that something is positive, right? It should be just positive or just negative. It shouldn't be like, yes, Yes, maybe kind of positive. Those variances in data entry, especially with paper records or spreadsheets, can make it a lot harder to understand and interpret your data and a lot harder to pull information that your auditor may need. Then you'll want to work on automating workflows and your procedures to reduce human error. This could be something as simple as scanning in samples with a barcode so you're not having to manually type in sample IDs and maybe type in the wrong sample. And then you need to hold your staff accountable through sign-offs and user tracking. This can be electronic signatures to verify that test results were accurate or that your electronic notebook is going to be accurate. Um, and then you'll also want to make investigations easier by centralizing that information. Having one system uh, versus 10 different systems can make it so much more accessible when an auditor comes through, because there's always a little bit of chaos when an auditor comes through, but having it all in one place can help reduce that amount of stress you're going to go through versus searching through multiple files in multiple locations. So finding a software that can help with all of that can make your life a lot easier when an auditor comes through. But how can LabKey help, right? So we have a few different softwares that can definitely help with your system. Right now, we're really focusing on our Sample Manager Starter and Sample Manager Professional, and then our LabKey LIMS. So Sample Manager Starter is great for small labs who are just getting started. It helps with our freezer management, sample inventory management. So you can track the data related to those samples, so check-in, check-out events, where they are in their life cycles, and it has that full audit log. Going up to professional, it goes into your assay data management and your workflow management. So folks have like a checklist of their SOPs and what they should be following. And then once you get into LIMS and LIMS Enterprise, this is where we really start automating more of those tasks. So it can be a lot more easier to kind of go through your tasks and reduce the amount of human error that's going to be associated with them. So if you're really interested in how we can help you out, see what tier you best fall in, feel free to schedule a demo with us. We'd love to talk about your lab specific needs and how we can help you stay audit ready. Any of our new Sample Manager professional clients or our LIMS clients can also receive our audit checklist as an ELN template. So that will be loaded in your system. You can use it every time you're doing an internal audit and go through everything and see if it's within your requirements. But thank you so much, everyone, for joining today. If you have any questions, please feel free to leave them in the chat or a Q&A, and I'm more than happy to respond. But thank you so much for attending. I really appreciate it, and happy holidays. And we did just drop a meeting to book a demo with us for Sample Manager or LabKey LIMS. So if you are interested in that, feel free to look in the chat and click the link. So some folks sometimes ask us how much support do we provide for when it comes to kind of getting your system actually set up and implemented in that. And we actually provide our full support so we can help import your historical data and get that imported. And we also help provide all the training that needs to go in with that. How easy is it to find samples in your system? So that's a great question. There's a bunch of different ways to kind of enter in your sample data. So you can search for it by when it was collected, when you froze it. That's some of the metadata you can search by. You can also search for it by those barcodes within Sample Manager and within LIMS. You can search for the sample ID, who the patients were and what samples came off of those. So there's a bunch of different ways for you to search for your samples depending on what your specific needs are, but it's super easy. So some auditors want access to our software directly. Do you have rules for auditors? Yes. So we do have reader access. So an auditor can have a login to your software and they can read everything in your system, but they can't make any changes. So that can be really important when they need to do that. But if you don't want to have your auditor have login access, you can also download our audit logs into like an Excel spreadsheet. And it looks like we have a hand up, Charlene. If you could type in the chat or a Q&A, I can answer your question directly. But if there's any other questions, feel free to drop them in the chat. Otherwise, we'll be logging off in just a minute. And thank you so much for attending. How can I know what software I should look for? Yeah, so that really depends on exactly what data you need to track. So if you're just needing to track where your samples are in storage, we can definitely help with Sample Manager Starter. If you're needing to track your assays or electronic lab notebook, maybe Sample Manager Professional or LIMS would be important. So knowing the types of data that you're capturing and where your struggles are, if you book a demo with us, we can work collaboratively with you and really partner with you and figure out the right solution, because we want to make sure that you're not getting more than what you need, but we also have kind of years upon years of experience in what works best for all of our clients. All right. Well, thank you so much, everyone, for joining. Feel free to book a demo with us. And thank you so much. Have a great one.